Southwestern Medical.
When you start talking.
Here is the doctor who has been attending Texas Governor John Connally.
I'm Dr. Robert R. Shaw, professor of thoracic surgery at Southwestern Medical School. Because of this position, I accepted the responsibility of taking care of Governor Connally for the
Doctor, let's start all over again. Thank you very much.
I'm Dr. Shaw, professor of thoracic surgery at Southwestern Medical School. Because of my position, I accepted the responsibility of taking care of Governor Connally following his injury. I want to say at the outset that the condition of the governor is quite satisfactory in view of the injury that he has sustained. He seemed to have been struck by just one bullet, which entered the right posterior chest close to the shoulder blade and coursed downward along the chest wall, taking out and fragmenting a portion of the fifth rib on the right. The bullet then emerged from the chest, evidently struck his right wrist, fracturing the lower portion of the right radius, and then entered the left thigh where it was spent. The thigh wound is trivial. The fracture of the radius should heal without difficulty or without further disability. Our major problem was the sucking wound of the right chest wall, because in making the wound of the chest, the fragments of the fifth rib became what we refer to as secondary missles, and these caused a considerable amount of tissue damage in the point where the missile emerged from the chest. When the wound had been enlarged in order to remove damaged tissue, the lung could be inspected. It was found that there was a tear in the middle lobe of the lung, which had to be repaired. There was also a small hole in the lower lobe, undoubtedly due to a small rib fragment. This was of no consequence. The major problem was a matter of completely controlling all bleeding points, removing all damaged muscle and tissue, and then securing a tight closure of the chest wall so that the right lung could be re-expanded. The governor's condition was good during all of this. He was perfectly lucid before anesthesia was started. And from what we know about his injury and his condition at the present time, we have no reason to believe that he won't completely recover without significant disability of any sort.
How long do you feel that the governor will be required to stay in the hospital here, Doctor?
The length of time that he will be in the hospital will be determined more by the clearing of the bruise to the right lung, and I would estimate that this would be in the neighborhood of 10 to 14 days. This doesn't mean that this injury will be completely clear by this time, but at least we should have a good idea as to the trend of the clearing. The trend of the clearing, whether it is clearing or not. Yeah.
Doctor, did you know the president is dead?
We didn't mention the President to Governor Connally. No.
He is out of surgery at the present time and resting in his room, is that correct?
No. They are now taking care of the compound fracture of the right radius. As soon as that is finished, he will be taken to the recovery room where he will be carefully watched until he has regained all of his vital signs. Now, his vital signs are good now, but we like to observe them for a period of time. This is a routine measure until blood pressure is stable, respirations are satisfactory, and until the governor is fully recovered from the anesthesia. In other words, he's fully conscious, responding rationally to questions. This is being taken care of. The bullet is in the leg. It hasn't been removed. This is a very insignificant factor, though. It will be removed. Left thigh, but there's no significant injury to the left thigh.
When will it be removed?
Before he goes to the recovery room. I think it would be advisable. No, this is really a reconstruction of what must have happened, but assuming, of course, that we know that the governor was in a sitting position. We know that the wound of entrance is alongside the shoulder blade here, that the wound of exit was here. We speculate that his arm perhaps was about in this position, and that it fractured his arm here, and then went on with him sitting into his left thigh. This is a matter of trying to reconstruct the trajectory of the bullet. He was shot from above, and he was in a sitting position. So we feel that this is all one bullet. That no. Yes, the lung was collapsed. However, don't stress that point. The lung can be easily re-expanded. It's like a balloon. You can let it down and blow it up again. The lung is now re-expanded.
Was he given a large quantity of blood?
We felt that the governor had lost approximately 1,500 cc's of blood. We counted in units, 500 cc's to a unit, and this is what has been given back to him. Quart and a half.
Sir, we missed the early part of your diagnosis and your explanation. Would you do it once more for us? His general condition?
Let's wait, please, sir, until the other questions are finished, and then we'll consider that. Any other questions?
What are they?
This is Dan Rather in Dallas, Texas. What you have been watching is the official briefing from the doctor at Dallas's Parkland Hospital who has been attending shot Texas Governor John Connally. As you heard, Governor Connally is in serious but not critical condition. Back now to CBS News headquarters in New York.
Minute and a half, run in the half, what had happened, and what had
You will start something, it's not very convenient.
Just do it once more, just a minute and a half resume of his condition.
All right. At the outset, I want to say that the condition of Governor Connally, considering the injury he has sustained, is satisfactory. His blood pressure is normal. We feel that his blood loss has been restored. The sucking wound of the chest has been now closed so that his chest is intact and he can breathe normally. It will take some time for the damage to the right lung, which is due to the blow to the chest, to clear, but this should clear with time, leaving no important disability.
describe the angle of penetration and the wound?
The governor was in a sitting position at the time he was struck by this bullet. The bullet entered his right shoulder, just lateral to the shoulder blade, coursed down across the right lateral chest, damaging the 5th rib, but sparing the 4th and the 6th rib. The bullet then emerged from the chest and went on to nick the lower right forearm, causing a compound fracture of the radius, and then spent itself by entering the left thigh.
How long is he apt to remain in the hospital?
My estimate is that he should be here 10 to 14 days.
What are the complications, Nate? What complications?
The main complication we always fear with compound fractures of the bone due to a perforating injury of this sort is infection. And we've done everything that we can do to try to ward off a possible infection of the wound of the chest wall. This will be aided, of course, by the use of antibiotic therapy.
Thank you, Doctor. Thank you very much.
Thank you, Doctor. Gentlemen, we'll try to keep it quiet with coffee in here. If there's anything that you need to find, let us know. We'll try to come together. Thank you very much. Nobody else?
All right, Captain.
No, not quite.